Hello and welcome. This is Aikari. I'm a multimedia reporter for Rappler. Welcome to the first budget webinar organized by Rappler and iLead in partnership with SMPP and Every Woman. So today we're going to talk about the social protections in the 2021 budget during the coronavirus pandemic. So we have a 4.5 trillion proposed budget for next year, but is it really a coronavirus budget? So we have Robert Sanders Jr. He is a policy research associate for iLead with a primary focus on economic development and public policy. Robert?
And hello, good afternoon, everyone. I'll be sharing with you the presentation that iLead prepared this afternoon. So for anything, we're iLead, we're the Institute for Leadership, Empowerment, and Democracy, a non-stock, nonprofit think tank consultancy research center. And our main areas of engagement are public finance and good governance. So right now, we're into fiscal policy research, advocacy in coalition building, and business insight and intelligence. So if you want to get in touch with us, that ribbon, the button right there is our points of contact. So for this afternoon, we'll be talking about the 2021 proposed social protection budget. So we've entered that phase into the year that we're talking of budget deliberations, where the budget is in the Congress and then it will transition into Senate. So this is the analysis that our org prepared. I think in view of the current situation that we're in, are we really prepared for social protection in 2021 with coronavirus in mind? But to situate this, the Philippine GDP dropped by 16.5% in the second quarter of 2020. And this is the largest drop, the largest contraction in the country's gross product in post-war history. And of course, that has significant effects for the average Filipino. So in 2020 Q2 as well, the average income of a Filipino dropped to levels that existed 5 years ago. So another way of thinking about this is like all the economic gains that the country achieved for the past 5 years were wiped out. And then numbers in jobs also reflect this. So first quarter of 2021, when the lockdowns hit, 17% of people who could work found themselves out of jobs. And then 2020 Q2, that improved a little bit with the easing of the quarantine restrictions, down to 10%. But as you can see in this graph, this still towers over the previous figures that we had. That's still 10% of Filipinos out of a job. In this paper from the Philippine Institute for Development Studies, we see that according to them, the effect of the pandemic could push 1.5 million Filipinos into poverty. And if everyone's incomes were to be cut by 10%, as much as 5.5 million Filipinos could fall beneath the poverty line. So from now, before we start tackling the budget, the one thing we'd like everyone to remember is that every curve that you see in the graphs, every movement, every number is a result of a political decision. We see this in plenary sessions in Congress and Senate, and we don't see them sometimes behind closed doors. So this is budget. This is the language of public policy, and we want everyone to keep that in mind when we're discussing these figures. So for the past 3 years, this is the total budget, the total pie that the government has been working with. 2019, 3.8 trillion, and then planned actual spending was 3.7 trillion. For 2020, with Bayanihan 1 and 2, that was 4.1 trillion, and planned spending of 4.3 trillion. And for 2021, 4.5 trillion, the highest it's ever been. Planned spending of 4.467 trillion. When we break this down to sector, that means what general area of service this devolves to. 36.9% of that is dedicated to social services. So this is your education, this is your social protection, this is your health, etc., etc. 29.9% economic services. So this is infrastructure, these are loans, these are support to government-owned and controlled corporations. 16.1%, that's for general public services. So this is the overhead, the cost of running government, the salaries, the maintenance and operation of government facilities, etc. 12.4% to debt burden, and defense 4.7%. So if you look from 2005 to 2021 proposed, it's quite encouraging to see that social services is on top. It's been increasing, but if you notice from 2017, it hit its peak, and it's been going down since. Although it's quite encouraging that for 2021, the share of the social services in the national budget increased a little bit. Same for infrastructure, been increasing, dipped in 2019, but back to increase again to 2021. General public services, generally decreasing, and also debt burden from being the highest share in 2005, it's now in the bottom. And then defense, mostly flatlining. Although one thing that we should notice here is from 2018 up to 2021, the share of debt burden has been increasing again. And this is especially important. I think recently, Finance Secretary Dominguez said that Filipinos should prepare for more taxes in 2021 and 2022 to pay for debts that we incurred during the coronavirus. So when we say social protection, we think of DSWD because it's the main agency that's tasked with ensuring social welfare and development. And these expected outcomes come from the DSWD itself. This is what it purports in the national budget to aim to achieve. So for DSWD, we expect them to improve the well-being of poor families, to protect and promote the rights of poor and vulnerable sectors, to ensure immediate relief and early recovery of disaster victims and survivors, to ensure the continuing compliance of social welfare and development agencies to standards in the delivery of social welfare, and of course to improve the delivery of social welfare and development programs through LGUs and their local development programs. When you look at the overall DSWD budget, so this is the DSWD Office of the Secretary plus the other attached agencies, you see that it's been generally increasing, and that's encouraging from a social protection standpoint, from 34.3 billion in 2011 all the way to 171 billion in 2021. This big spike here in 2020 plus Bayanihan 1 and 2 is because of the realignment. So for 2020, originally only 164 billion. Because of Bayanihan 1 and 2 with the social amelioration program, etc., spiked to 381.4 billion. And then right back down to 171 billion. And this decision is one of the things that we'll hope to interrogate this afternoon. So for total DSWD, total appropriation across the years, this is just a breakdown. We see that total agency is 171 billion. A bulk of that, actually 169 billion, is with the Office of the Secretary. And then Council Welfare of Children, it decreased actually from 118 billion in 2020 down to 61 billion. Inter-Country Adoption Board increased by a bit. Juvenile Justice and Welfare Council increased by a little bit as well. NAPSI increased by about 8 billion. NCIP increased by about 15 billion. Actually, National Council on Disability Affairs decreased a bit. And this is a novel creation of the Duterte administration, the Presidential Commission for the Urban Poor, it got a little bit of a boost. So now we go to the program levels of the Office of the Secretary, an increase of 7 billion from a pre-COVID situation to a COVID situation, or 4.4% increase. For 4Ps, Pantawid Pamilyang Pilipino program, that is 5 billion increase, so 4.63%. Sustainable Livelihood program took a hit. It decreased by 1.2 billion, or about 20%, 1/5 of its entire budget was cut. Foreign assisted component of the Kalai Seeds program, which is 1 billion, ended, but that was made up for in the locally funded component, an increase of 1.585 billion. Supplementary feeding program, no change. Social pension for indigent senior citizens, only 2.9 million increase. Protective services for individuals and families in difficult circumstances, 3.3 billion increase, or 37.69%. This is one of the more significant increases that we see in the Office of the Secretary's budget. And we think this is what the DSWD will rely on to address the needs of those who don't exactly qualify for 4Ps, but still need protection or safety nets. And then assistance to persons with disability and older persons, 1.8% increase, the same for comprehensive project for street children, street families and IPs, and reducing vulnerabilities of children from hunger malnutrition. So all relatively marginal increases, like 1 to 2%, except for protective services for individuals and families in difficult circumstances, and the Kalai Seeds program. Other components of the budget, tax reform, cash transfer project. So this was the measure enacted in 2017-2018 to cushion the effects of strain 1, higher higher prices, that ended. So no more tax reform cash transfer for 2021. And this is not a policy decision. This is by operation of law. Services to distressed overseas Filipinos, an increase of 1.2 million. Services to displaced persons, deportees, 900,000. Recovery and reintegration of program for trafficked persons, 400,000. Disaster response and rehab, 114 million or 6% increase. National resource operation, 800,000 or 1.8% increase. So all of these also quite marginal increases, all in the single figures. Quick response fund, no change. Pamana, no change. Here, so far, we take a note that for the middle of the year, Q2 of the Philippines, the DSWD has already disbursed 131 billion out of the available APRO of 369 billion. So halfway into the year, it's been able to disburse about a third of its funding. Here we see a visualization of the major social welfare programs. 4Ps dominates the allocation. Here, it's been steadily increasing from 2011 to 2021. And then the other programs, some have been fluctuating. If you take note of the Kalai Seeds program, that's this yellow bar here. 2015, it was quite high and then decreasing all the way to 2021, where it's barely a blip in the graph. However, a different story for social pension for indigent senior citizens. Gradually increasing through the years, 2015, 16, 17, until it reached about 23 billion. But as we noticed, it barely grew from 2020 to 2021. And then protective services for individuals in difficult circumstances, almost the same, big drop in 2017, but it's been recovering from 18 onwards. So we look at particular growth rates for some of these major programs. 4Ps, it enjoyed a big jump in 2011, but has been erratic since then. So 2012, only 35%, down to 12, and then up 41. 2015 didn't change at all. 2016 just increased by 1%. 2017, 25%, then 14%, then didn't change, then 21, and then 5. So ideally, with the lens of social protection, you'd like to see these budgets grow. So you want an upward trajectory, an upward line. But we don't see that here. And we also don't see that for the Sustainable Livelihood Project. In fact, for 3 years, from 2017 to 2019, it's been on the negative. It's been contracting. So from 2017, 5% decrease, and then 44% decrease of the following year, and then 66% decrease in the following year. It doubled in 2020, probably because of a low base number. But then by 2021, it was cut again by 22%. Kalai Seeds, from 2016 to 2020, it hasn't grown. It's been receiving cuts in funding. 36% cut, and then 7%, and then 47%, 48%. So for 3 consecutive years, its budget has been halved, actually. And then an increase of 36% for 2021. Social pension for indigent senior citizens, it's been fluctuating also, but here it's on the positive. It hasn't decreased. 2016, a drop of 46.1%. Big jump in 2017, 105.9. I think this was around the time that the EO was signed, increasing the budget for social pension for indigent senior citizens. And then 7.5% only, and it's been anemic since then from 2018 to 2021. This was pointed out by one of our panelists as well. No? Though the gap in coverage of social pension has slightly been closing from 2011 to 2020, we still see a huge number of them uninsured. 2011, it was the worst, I think, one of the worst. So 6.5 billion of seniors in the population, and only 139 billion of them were covered. Fast forward to around 2016 to 2017, big boost. So from 1 billion to 2.8 billion covered. So while the gap has been closing, there's still a pretty big gap. When you look at 2020, that still translates to about a little more than 5 billion of uninsured seniors. And then we look at spending performance of DSWD. So it's one thing to give a department funds. It's another thing to measure if it's able to actually implement programs using those funds. DSWD, by our evaluation, is actually pretty decent in disbursing its funds. The blue line is obligation rate. That is how much it's able to contract, how much it's able to implement compared to its spending authority. So very high figures, improving actually from 2014 to 15, 87, 82, and then reaching the high 90s from 17, 18, and 19. So far, as at the middle of the year, it's been able to obligate about half of what it's authorized to spend. And then disbursement is how much they're able to actually spend. So obligation is contracting, disbursement is actually spending the money and releasing it. So about 78%. So this is what puzzles us actually, because agencies are sometimes given lower appropriations for the following year because they're not really able to disburse, they're not really able to spend. DSWD doesn't really have that problem because as shown in this graph, they've been able to obligate and disburse. So that the question then remains, then why decrease some of these programs, especially if it's social protection, and especially since under this COVID environment? No? So as we see from the bigger picture, there's no more SAP for 2021, but higher budget for infra and MUPs. So DSWD received just a 7 billion increase if you compare the 2020 GAA and the 2021 NEP. However, the decrease would actually be bigger if you add Bayanihan 1 and Bayanihan 2 because of the social amelioration program. Meanwhile, for other infra projects and funds for military and uniformed personnel, we see big jumps. DPWH, 581 billion GAA, some of it taken away, 142 billion to fund other social services here during the COVID pandemic. But then that was reinstated plus in 2021. It got 667 billion. DOTR, about 20 billion more. PNP got about 3 billion more. Philippine Army got about 3 billion more. Air Force, 2 billion. Navy, about 2 billion. GHQ, 7 billion. And then the AFP modernization program actually jumped up by 8 billion from 2020 GAA to 2021 NAP. And then this is also novel this year, a new introduction, the Support to Barangay Development Program of the National Task Force to End Local Communist Armed Conflict. That's 16 billion out of nowhere. So it's a new introduction in 2021 now. Then Pension Gratuity Fund, big jump, 116 billion to 172.8 billion. So, and then Office of the President, Confidential Intelligence Expenses, 4.5 billion, no change. So we bring up the question of what really is the priority of spending for the following year, especially we're in this COVID pandemic. Is it still infrastructure and the support to these military uniform personnel, or maybe we should start pivoting to focusing on social protection? Aside from that, other concerns that we keep in mind, we're in a global and domestic recession. So the overall product of the world and the country is being challenged. Again, that 16.5% shrink in our budget, I mean in our GDP, should be demonstrative enough. Widening fiscal deficit, meaning that the government has been spending more than it's been collecting. And to remedy that, they've been borrowing more and more. Increased unemployment, as we saw in the graph earlier, more returning OFWs and lower OFW deployment and remittances. So while the OFWs were able to save us from financial crises before, now it looks like they also need saving because this COVID pandemic affected everyone in the world. So we can't really count on overseas economies to save us like the OFWs have saved us before. 2021 as a pre-election year. So when you consider the real politic of it all, by around second quarter of 2021, the mindset of some of these politicians will of course shift to the next big prize, that is the 2022 elections. Challenges to the delivery of key services, very relevant to a lot of us, education and other extension services like agriculture, non-COVID health needs also. And then preparations to implement the Mandanas ruling that brings into question what services will the local governments have to assume and are they ready? And then other emerging infectious diseases like I think the swine flu that the Department of Agriculture has been talking about for quite a while now. And then here some questions to ask from us, on implementation. What is the status of the SAP? before we start talking about the 2021 budget, let's first talk about the SAP, because there's been news that there were actually savings from the SAP, which is quite questionable. Are there new measures lined up to improve service delivery? And has there been an update in the list of 4Ps beneficiaries since the pandemic? With this wipeout that the economy has experienced, maybe there are more families that now qualify for 4Ps compared to last year. And is DSWD planning to update their targeting survey? And then generally on plans and programs, is there a new strategy and framework for social protection given COVID-19? Or are we still operating on a budget that takes on pre-pandemic assumptions? And then of course, more concretely, why cut down on the Sustainable Livelihood program and why only marginal increases for major programs? So those are the questions you want to bring up. We hope we leave it to the discussants, the panelists, to ably talk about these issues. So that's it for the budget analysis from Eileen. Thank you.
Okay. Thank you for your very insightful presentation on the DSWD budget. So as we heard from Robert earlier, at least 171 billion will go to DSWD from the 4.5 trillion proposed 2021 budget. So it's still in Congress. The amounts can still be changed. Maybe this is where our panelists can come in. So before we start our roundtable, I'll start with introducing the four of them. So we have here Aura Sevilla. She works primarily towards the realization of active and dignified aging in the Philippines and the regions. She's currently affiliated with various international NGOs and the Commission on Human Rights in the Philippines. Dr. Sylvia Estrada Claudio, she's the Dean of the College of Social Work and Community Development of the University of the Philippines. She is a professor of the CSWCD's Department of Women and Development Studies. Annabel Luna is the Secretary General of Samahan ng Nagkakaisang Pamilya ng Pantawid and works closely with DSWD, LGUs, and stakeholders in crafting decisions and policies about the program. And lastly, we also have Tanya Quijano. She has worked in the development sector, focused on alleviating poverty and improving the quality of life of those in the vulnerable sector. She worked in the DSWD for 5 years, acting as its head executive assistant in her past post. So, hello. Lahat pala tayo dito ngayon, babae, no? Yes, hello. Parang naka-mute pa po ata kayo.
Okay.
Yan. Hello, everyone.
Hello.
Hello,
Okay.
Aika. Hello po sa lahat.
Siguro for sa first lang natin, no, pasadahan lang natin. What can you say about the presentation, no? And I think the most central question to this is how can this budget, this proposed DSWD budget, be used to help the vulnerable next year, especially that the country is still reeling from the effects of the coronavirus. Maybe we can ask first Ate Annabel.
Hindi po yung masasabi ko dun sa presentation kanina ay yung paghimay-himay ng budget para sa DSWD. Nagkaroon tayo ng konting increase dun sa 4Ps kasi alam naman na po, meron po kasing mga set 9 na lumabas, yung mga bago po nga na mga 4Ps beneficiary po. At yung iba may set 10 na rin, kaya siguro medyo nagdagdag po ng budget. Pero yung yung pagtingin din po dun sa SLP, kasi yung Sustainable Livelihood Program po ay isa rin naman dapat makatulong, lalo na ngayon sa panahon ng pandemic. Kasi kung titignan po natin doon, medyo mababa yung naka-allocate sa kanya. Pero dapat siguro kasi kung panay ayuda lang kasi, hindi ho yan sapat lalo na sa mga natambak natin na bayarin po yung ilaw, tubig, nangungupahan pa, lalo na po itong mga poorest of the poor na katulad namin, 'di ba? Na masasabi namin po atang masakit man sa damdamin, pero gusto ko magpakatotoo na parang masasabing extremely poor na ata ang karamihan sa amin dahil sa pinagdaan ng lockdown, 'di ba? Dahil walang konkretong pagtugon doon. Kaya kailangan sana siguro mapag-aralan pa yung budget sana na may ayos pa, nabigyan pang ng pansin yung mga kaysa mapunta sa iba't ibang departamento na yung PNP ang laki ng budget, sabi ko na kung mapapansin, no? Kailangan po natin ngayon talaga yung matugunan yung kinakaharap at mapataas talaga yung rate ng trabaho kasi bilang purpose din naman po ang kala ng iba tamad po kami pero yung mga nagtatrabaho sa amin kadalasan sa panahon ngayon sa ground wala akong trabahong matino. Kung meron man trabaho imbis na isang linggo sa isang complete na isang linggo ang papasok mo, minsan twice a week na lang po. Yun yung mga nangyayaring realidad po na alam naman po natin tapos isasabay pa yung mga natin na kailangan talaga aside doon sa ayuda ng gobyerno, meron talagang matibay na na solusyon, trabaho po ang ibigay. Tapos yung mga nanay na hindi kaya magtrabaho na medyo may edad na rin, doon papasok yung mga livelihood natin na sana pagtuunan ng pansin na hindi yung magpapahiram tayo ng puhunan sa livelihood tapos in the pagka first week kagad, unang week pa lang, magbabayad na tayo ng paghuhulog. Hindi ho makakaikot po, lalo na pag sinabahayan ng emergency po. Hindi natin inaasahan niya, mga emergency na nangyayari po talaga. Siyempre, ang kailangan po natin muna, di ba, isalba yung buhay o yung ating sana kumakalam kung ano man. Kaya mahuhugot si 5,000 kasi yung karamihan po, 5,000 po yung nire-release nila sa SLP. Yun po yung nangyayari. Tapos, doon nga, napansin ko, kasi doon ako magpo-focus sa purpose na ginagalawan ko, yung nangyayari po ngayon sa mga SAP po. Yung SAP po, meron pong iba nakakuha na yung may mga cash card. No? Pero yung wala pang mga physical card na hawak, sila po yung nagsasuffer. Lalo na may mga problema ho sa cash card. Na ultimo grant and ayuda sa 1 and 2, wala ho sila. Kaya isa po yan sa nagiging problema natin at talagang kami po ay inuulan bilang boses ng Pantawid Pamilyang sa SNPP. Inuulan po kami ng pakiusap sa kapwa ng beneficiaryo na sana matulungan na po silang makapag-pay out o makuha yung nararapat po para sa kanila. Yun po yung mga hinaing na aming daladalahin at pilit na gustong tugunan din sa pakikipag-partner po sa DSWD. Ganun din po yung mga nagpapasalamat din po ang SNPP sa tiwala dahil kahit pa paano, bilang isang mahirap din, binigyan kami ng pagkakataon tumulong doon sa mga kapwa namin na iparating yung mga ayuda na galing sa mga private sector. Yun po yung napagtataya ng aming oras, ng aming sinasakripisyo na walang halaga yung takot basta makita mo may ngiti at alam mong malalaman ng sikmura ng kapwa namin may hirap. Pero dasal din po namin, ito pong budget na ginagawa talaga na sana ilaan natin talaga sa mas DSWD yung mga nararapat na proyekto na makakatulong talaga sa maralita. Tapos, yan din pagtingin yung mga middle class na nagtatrabaho rin lang para kumita at meron din po sila mga obligasyon. Sana po, ganun po ang pagtingin ng gobyerno na talagang lawakan pa po. Yun yung mga yun ang maaano ko po. Yung sa SAP po, pa po nila, kung hindi na talaga kaya kasi meron umaasa pa rin na iba na sana may SAP 3 pa ang purpose. Pero kung hindi talaga po, trabaho po, pakiusap po namin at talagang yung panimula kung babangon ulit. Kasi gusto po namin bumangon at balang araw kami rin po ang makakatulong sa kapwa namin. Yan po yung aming layunin din.
Salamat po, Ate Ana. Siguro next, we can ask Aura Sevilla to talk about naman kung ano yung nangyayari din among our senior citizens and the aging population.
Thank you, Aika, and thank you, Ate Ana. So, yung mga situation din naman na binanggit ni Ate Ana, very similar with what's happening with social pension. But I just would like to emphasize 2 points about this, the presentation of Robert, and related to the DSWD budget. Number 1, the issues na kinakaharap ng social pension are issues na meron na bago pa mag-pandemic. Ibig sabihin, these are long issues na iisa-isahin ko kung ano-ano yun. At isa na dito, number 1, yung malaking targeting issues. So noon pa, kasi by definition of the law, ng RA 9994, Expanded Senior Citizens Act, ang definition niya ay indigent senior citizen lang yung makakatanggap. And by definition, these are the poor, elderly, na sick leave, frail, with disability, with no source of income, no pension, at saka no support from the family. So very vague yung definition. So very subjective siya. So meaning, pwede mong sabihin wala kang nare-receive na support from the family, or pwede mong sabihin wala kang trabaho. So there's so many interpretation of this. Kaya meron tayong tinatawag na targeting errors, meaning mayroong inclusion at saka exclusion. Merong inclusion, hindi naman dapat makatanggap, pero nakakatanggap. Exclusion, may dapat makatanggap, pero hindi nakakatanggap. So this issue, matagal na to. And by the way, 2011 nagsimula yung social pension. And currently may 3.8 million, no? Correct ko lang. 3.8 million yung naka-budget for this year. So dahil dito sa fundamental issues dun sa design ng social pension, so may mataas yung administrative cost kasi you have to do validation year after year. You have to validate whether these people are really poor. No, kahit bedridden na, ibabalidate pa. Kahit 90 years old na, 95 years old, ibabalidate pa kung totoong mahirap or hindi nakakatanggap ng support from the family. So, yung administrative issue na to, so you have to hire again validators just to make sure kung si Lola na 95 years old, talaga nga bang mahirap. So, this again delays the process of course, those na receiving. Kaya as a result, last year, 2019, around 10% pa, 2019 pa to hindi pa nakaka-receive ng social pension nila last year because they had to be validated. So, third issue is high social cost. So, dahil nga dun sa mayroon na bakit yung kapitbahay ko nakakuha, pareho lang naman kaming mahirap. Bakit hindi ako nakakuha? So, yung meron ganun silang usapin na ako din naman nag-contribute ako or sa issue ng mga may pension ng SS, bakit ako yung SS ko, hinulog ko to. Ilang pung taon ko tong hinulog, pero bakit hindi ako nakakuha ng social pension? So, bakit wala silang hinulog, pero may 500 sila? So, nagkakaroon pa ng tension between the senior citizens and nagkakaroon pa ng comparison. Bakit sila hindi nakasama doon sa programa na they think they deserve them to get kasi walang-wala na rin silang pinagkukuhanan ngayon dahil obviously doon sa hindi rin sila kasama sa nagtatrabaho. And number 4 is yung issue natin dito is yung budget inequality. Maganda pinoint out ni Robert yung pension and gratuity fund, no? Kasi for so many years, this is a lump sum budget na hindi na o-audit. So, hindi natin alam kung sino talaga yung nakinabang. Pero, but based on the records, yung target na makatanggap nito na older persons are nasa around 200,000 lang. But the budget is around 116 billion last year. Tapos ngayon, 172 billion. So versus, tingnan mo yung social pension, 3.8 million yung makakatanggap, pero ang budget mo lang is 23 billion. So yung high inequality, we're not saying na dapat hindi budgetan yun. No? Pero bakit kung nakakapagbigay tayo ng malaking budget na ganito, for these senior citizens or older persons, for the contributions that they've made, why can't we also give this kind of budget dun sa mga senior citizens na have contributed all their life, whether monetary or by still doing, like taking care of their grandchildren and all of even yung pag-raise ng next generation. So, yung contributions nila na yon hindi yon na re-recognize. So, then last point that I'd like to is nag-COVID na. But the budget has not increased. Yun lang 0.1%. Despite the fact na number 1, tumaas yung increased poverty rate, sabi nga by 10%. So dapat at least may 10% kang increase ng budget. Number 2, dumami din yung senior citizen this year kasi those are yung nag-turn ng 60. So, dadagdag dapat sila ngayon. So, dapat may automatic na increase. So, tapos, nag-release pa yung government ng movement restriction sa senior citizen. So, meaning, pag 60 years old ka, sa bahay ka lang. So, although inaalaw nila na pwedeng magtrabaho si senior, pero syempre, yung ano na rin nito, yung impact na rin nito, pati do sa health nila, they're the most at risk, no? Na population. Yung intention natin na protektahan sila from the health risk, yun yung, do we have enough social protection for them if we keep them at home? Kasi kung yung anak nila nawalan din ng trabaho, so saan sila kukuha ng panggamot nila? So kaya maraming senior citizens, yung kahit na alam nila na at risk sila, wala silang choice kung hindi magtrabaho. Kasi nga, wala naman silang nare-receive na kahit anong support. Tapos, dagdagan ko lang ng gender perspective. And alam naman natin na maraming senior citizens na kababaihan walang pensyon. Kasi when they were younger, dahil wala silang access with formal employment. So, nag-accumulate to, kaya pagtanda nila, wala silang pension or mas mababa yung pension nila. Bukod pa sa may bias din yung computation natin ng pension based on gender. So, dahil din marami sa kanila nasa informal economy, na patuloy na nagtatrabaho despite their age. So, dahil ito yung pinaka-informal workers, yung pinaka-naapektuhan ng ating pandemic, so mas maraming nakakatandang babae ang talagang mas naghirap ngayon. No, but these are not being looked at or nakakalungkot, sobrang nakakalungkot na hindi man lang nadagdagan. Nung nasa, last point lang pala, last week sa DSWD hearing, may 91,000 na waitlisted na indigent senior citizen ang hindi makakakuha ng social pension. Ibig sabihin, kung waitlisted na to, more likely na validate na, nakita na mahirap talaga sila. No? Pero hindi na bigyan ng budget because wala na daw budget. No? So again, yan yung mga yung sad realities natin pagdating sa mga senior citizen.
Okay. Thank you, Aura. Buti nga na-point out mo rin, no? At nabanggit din to ni Robert kanina na ang laki talaga ng increase dun sa pension and gratuity fund. And we know, we know naman kung saan napupunta yung kalakihan ng budget na yon at yun ay napupunta sa uniformed personnel. So, I guess ang next po natin na magsasalita ay si Dr. Sylvia Estrada Claudio. Dr. Claudio, can you give us an assessment of the DSWD budget numbers?
Yes.
Yeah.
Unang-una, yung bigger topic kasi natin is social protection. No? At mahalaga itong social protection idea, lalong-lalo na sa panahon ng COVID. At kung titignan natin tuloy, ang tanong dyan, hindi lang naman kasi DSWD. Kawawa naman yung ahensyang yon kung siya lang ang, ang bibigyan natin ng mandato at sise at trabaho. Sa panahon na ito, na halos lahat tayo nangangailangan ng social protection. Sabihin na natin na napaka-inequitable na talaga ng Philippine society sa simula pa lang. Mas marami talaga ang mahirap kaysa sa mayayaman. At nang tumama, ay dumami pa nga yung mahihirap. No? Such that may mga realities tayo. Ano ba sa health? Bago pa man magka-COVID pandemic, kahit middle class family ka, natatakot ka sa severe illness. Kasi oras na tumama ang isang severe illness, pati yung medyo stable ang income can be pushed into poverty. At alam natin yung health system ngayon ay isa sa mga pinaka-importanting safety nets natin. No? A well-funded health system. Kaya bago ko puntahan yung DSWD budget, Aika, baka mamaya na sa next round kasi ayoko namang masyadong mahaba ang magiging sagot ko. First, unang salta pa lang hindi ba? Tanong natin sa sarili natin kung itong budget na ito at yung mga taga-ILEAD ang unang nagturo sa akin ng tamang tanong itong budget bang to ay budget upang harapin ang COVID? At upang tayo ay makaraos sa COVID. No, at ang sagot diyan, kahit totoo na mas medyo pinakamarami yung DSWD budget, ang sagot kasi diyan hindi siya. Kasi if you look at the overall budget figures, no, hindi siya, ngayon dapat nagbubuhos tayo ng malaking pera. Kasi sabi na nga ng presentation mismo ni Robert, we are in deep recession, no? Ang katulad lang ng pangyayaring ganito kasama ang ating ekonomiya ay ng panahon ng giyera at wiped out ang mga gains, no? At isasama natin dyan yung kwento na nga nung dalawang naunang panelists sa akin na talagang sa ground, dun sa araw-araw na nararamdaman ng mga tao, ay hirap ang mamamayan. Talagang nabigwasan tayo ng husto ng COVID and we are in a calamity situation. So, overall, this is not an adequate budget. And it's not a COVID budget. Kasi pupuntahan ko na, is this enough? No, it's not enough. It's not enough kasi it's not just the DSWD budget. We need to begin to build hospitals. Kasi na-test talaga yung ating healthcare system. At nagkukulang talaga tayo sa facilities. At ang healthcare system natin, hindi mo pwedeng ICU lang ang i-build mo, no? Para harapin ang COVID, magsisimula ka sa primary healthcare level, kung saan ang daming pagkukulang, mismo lang sa ilan ba yung midwives. Ang daming unfilled midwife positions. Ang daming fulfilled barangay health worker positions. May gender angle yan kasi babae yung may i-employ mo sana. No? So yun yung una. Secondary care, lahat ng levels ng ating healthcare system ay kailangang tulungan at hindi lang yung magiging sapat yung tao, kagamitan, serbisyo, kailangan din naman na sapat ang financial protection na ang pangunahing instrument ng gobyerno dito ay PhilHealth na nag-declare na itong mga ito na wala na daw silang magiging budget. So, nasan yung pagsiguro na may budget pa rin yung PhilHealth kasi doon umaasa yung tao at in fact that budget should be increased. By the way, I disagree with them kasi ewan ko kung ano yung drama nila na mauubusan na yung PhilHealth, no? Kasi yung sin taxes natin dapat pumapasok doon. Kaya dapat may access sila. Kaya hindi ko alam, no? So that's the first, no? Overall, this is not, ewan ko kung saan nakatira ang ating congressmen at ang ating executive, na yung budget nila ay para lang yung budget na nga. Yun din ang malinaw na nag-come across sa akin kahit social services pa lang yung pinapakita ni Robert, ito ay budget na parang wala lang nangyari. Parang it's the same budget as 2019 na parang hindi nagka-COVID, no? So, that to me is what is this budget. And I'll stop, Aika, because I don't want to monopolize the conversation. But I'm not an economist. But I am, however, a development expert. And we've always said that wala kaming kinakatakutan na mag-increase ang ating debt, hindi masamang mangutang kung ang pang-uutang ay mapupunta sa tunay na poverty alleviation and development projects. Governance issue din to, by the way. Kaya rin kaya itong budget ay ganito. May governance issues din tayo. I think if we bring out yan later, this is more a budget for elections. Parang wala lang nangyari, business as usual budget ito, no? Pero kami malinaw dun sa aming development studies at kailangan namin mag-usap ng mga ekonomista nito. Kung umutang ka, kahit malaki yan, basta ipasok mo sa social welfare services ng mamamayan, which now includes urgent job generation. This is the big social protection. Sabi nga ng ating panelists ng taga Kalai Seeds, sige, wag nyo na kami bigyan ng SAP, bigyan nyo na lang kami ng trabaho. Kasi ito talaga yung one of the big poverty alleviation and social protection measures natin. The employment of people which is so much at risk now. No? So if you want, maybe we'll disagree kasi of note kay Robert yung increasing budget deficit. No? I'm with other economists like the Congresswoman Kimbo who proposed a big incentive fund na sinasabi niya, sige, magkautang na tayo. I'm also there. I don't mind widening the deficit because while I'm not an economist, coming from development studies, if umutang ka ngayon at gamitin mo yan ng tama, makukuha nating bayaran yung deficit na yan. Kasi it has always been clear, again from the feminist economics viewpoint, it's not the money. It's what you want to spend the money for and how you're going to spend it. That is important. The nation doesn't necessarily have to be a household. The nation can go into debt because we can find ways to make that debt up and make that good sa panahon na tama ang ating use of our money. No? So yun lang muna. In short, nakakatawa itong budget na to kasi mukhang hindi yata nakaapak sa lupa ang mga nag-propose kasi the budget doesn't look like COVID happened. It's the same old budget with slight differences as if they thought baka naman may COVID.
Okay. Thank you po, Dr. Claudio. And ang buti na point out niyo rin po na isa rin siguro, hindi siguro may kita talaga natin na meron talagang governance issue dito kung bakit parang pumipreno sila sa pagbibigay ng budget increase, no? And with that, maybe I can ask Tanya Quijano to give us an assessment of the DSWD budget, given na meron ng governance issue na bring up.
Ayan. So, salamat, Aika. And then, siguro, pangunahin ko lang, salamat din sa isang forum na to kasi sa palagay ko, ang budget process talaga ay isa sa mga proseso ng gobyerno na kailangan kinakalok natin dahil nga sinabi na kanina na governance issue at nakagabit nga ito sa budget natin. So, gusto ko lang din sabihin na ang COVID-19 na kinakaharap natin ngayon ay hindi yan nagtatapos at the end of the year o at the end of a fiscal year. Ang projections po ng UP Pandemic Response Team aakyat hanggang 250,000 yung magiging affected ng COVID. 100,000 noon ay magiging active hanggang December 2020. So paakyat po talaga ito. Pangalawa, aside from the loss of jobs and unemployment, nagiging maigting talaga yung kagutuman. Yun kasi yung unang nagsa-strike kapag nawala ka ng trabaho, talagang gutom yung makakaharap mo. At halos 21% po or 5.2 million na sa ating mga kapwa Pilipino ang tagutom. And then masasabi ko rin na itong mga vulnerabilities, itong mga challenges na nakakaharap natin sa COVID, bago pa tumama ang COVID, nandyan na yan. Yung kahirapan nga pag-access sa health, yung kahirapan din makakuha ng mga trabaho, at siguro yung access din sa iba nating mga social protection packages. Yun nga, nakita natin throughout the years, although it's been improving, yung access din talaga yung nahihirapan yung mga ibang tao. And I think na-bring up din ito ni Aura nung last na usapan natin na social protection as a whole, talagang below siya sa international standards pagdating sa linalaan na resources ng ating gobyerno. So, bakit nga ba mahalaga ang social protection? Ano bang ibig sabihin ng social protection at bakit ito importante? No? Kasi social protection yung salbabida natin o lifeline natin sa mga pinaka-vulnerable na parte ng ating populasyon. So, pag hindi natin sila talagang tinulungan, siguro lalo pa after several years na talagang nasa kahirapan sila, mas gagastos pa ang gobyerno pag di natin sila sinagip ngayon. Kaya importante po talaga itong mga flagship programs na inayon din ng DSWD kasi mas magiging developmental track talaga ang mangyayari sa ating mga kapwa. Ayun. So, siguro nga nabanggit ko, so parang in terms of social protection, the coverage, according to ILO, right now, parang 47% pa lang ng ating targeted beneficiaries for social protection ang covered. So, maliit yun. Sa health, nasa 98% na tayo, pero yun nga, another question of access, paano ba na-access to mga PhilHealth benefits and all. And then second, in terms of percentage ng GDP, sa social assistance, 0.7% of the targeted 1.5 between low and middle income countries pa lang ang nare-reach ang Pilipinas. Overall, 2.8 pa lang ng ating GDP ang nagugugol natin for social protection, when in fact, to achieve the gap until 2030, 3% to 5% of our GDP ang kailangan. So, prior to COVID pa to ha. So meron talagang malaking gap in social protection dati pa. Dahil nga, mas lalo itong napansin natin na nagkaroon ng COVID, talagang yung inequalities, yung injustices to access to basic services, sobrang naging mas kita siya ngayong COVID. So, hindi lamang yung health system yung na-test natin, pati itong mga social protection systems na dinaanan ng resources even before, talagang na-test siya. So sabi ni Robert doon sa kanyang presentation, 1.5 million people might be pushed into poverty. So in 2015, World Bank said na yung pantawid no, nakapag-lift siya ng 1.5 million out of poverty too. So baka in just a single event of this COVID, na-wipe out po yung mga gains na yon. So napaka-importante po talagang maibalik sila sa pagkakaroon ng tamang protection. And then lastly, I'll share siguro yung mga tingin ko no, na pwede nating tingnan pa dito sa DSWD budget. Dahil ngayon nga, gusto ko rin lang i-echo yung sinabi ni Dr. Claudio na parang ang hindi COVID yung nandito. So nasa emergency po tayo, nasa crisis po tayo. Hindi po talaga tayo business as usual. So yung amount of protection that we need to give out and aid should be higher. And also how quick and how responsive our systems are should be there. So siguro yung mga things na I can recommend or say is yung talagang pag-harmonisa and improving our targeting. Siguro, ang nangyari po kasi noon, kaya umabot ng halos 3 buwan yung paglalabas natin ng SAP na kinakailangan talaga doon at doon pa. Naghahanapan kasi ng listahan eh. So, nakakapagtaka na overlook yung ating listahanan. So, baka hindi rin po alam ng iba, pero meron kasi tayong registry ng mga poor na sana doon na pagkuhanan, pero nagkaroon pa ng back and forth between the national government and the local government. So, mas maganda sana yon lalo na meron tayong national ID, pero mukhang doon sa kanilang timeline ay hindi pa aabot. 5 million pa lang ang i-register nila sa national ID, pero ngayon nakapag-assess na ng 4.3 million households ang listahanan 3. Pero kung sinasabi natin mas marami pa doon ang nangangailangan sa ngayon, kailangan talaga mas maging proactive tayo sa paghahanap ng mga taong na naapektuhan ng pandemya, lalo na yung mga nasa informal sector. Ito yung tinatawag nating missing middle na wala kahit saan man sa ating mga databases. So sana ngayon ay mas mahagip na sila ng mga protection na ito. Pangalawa, yung ating delivery systems nga, no? So, paano ba natin mapapabilis lahat to? So, mula sa SAP, ayon dun sa Senate budget hearing kumailan lang, merong 10 billion in savings pa sa SAP. At gagawin daw ito for livelihood. So, kung ganun, kailangan natin tingnan itong Sustainable Livelihood Program. Dun sa presentation ni Robert, I think mga 4 billion yun, pero may dadagdagan pa to ng 10 billion. So, paano ba natin mapapabilis yung paglagay nun? May mga rapid assessments na pong naganap sa SLP. So, kailangan tugunan yung mga implementation bottlenecks na meron doon. At yung last naman, yung sa mga statutory programs natin, o yung supplemental feeding, yung for traffic persons, lalo na tumaas din ang violence no, against women and children. Meron pa tayong mga tao sa evacuation centers, yung mga displaced persons natin, anong gagawin natin sa kanila? We also have our PWDs and also our incoming OFWs. So parang doon nga sa budget, nag-static siya eh, pero tataas din yun eh. So anong gagawin natin doon? And gusto ko rin din po i-highlight na if we're looking at delivery systems, parang importante din po na protektahan natin yung mga kapwa nating social workers dahil lumalabas po talaga sila sa field eh. So, nag-request din po kami talaga kung paano ba mapoprotektahan yung ating mga frontliners dahil ang mga social worker at ang ating mga community organizers, mga frontliners din po sila. So, importante din po yung consideration dito sa COVID. And I think lastly, no, parating na po ang mga disasters. So, tag-ulan na. Ayun, si Ate Ana nga, na-disconnect pa dahil sa ulan. So, paano na pag nandyan na ang mga baha na kailangan na mag-evacuate? Ano po ang contingency plan na atin DSWD kasi yung sa relief, pero ang disaster management, alam natin, maraming ahensya yan. So ano po ba ang plano ng ating gobyerno at paano yun nare-reflect sa ating budget, lalo na pagdating ng mga iba pang disasters? Yun po.
Okay.
Kung may dagdag rin po yung iba sa mga ibang programa, yun po.
Thank you, Tanya. Na-explain mo naman sa amin kung ano yung mga dapat tignan, no? At kasama na din dun yung iba't ibang sektor na hindi naman talaga sila nakakuha ng ganong kataas na budget para dun sa, yung mga programa na dapat nagbibigay ng tingin sa mga sektor. So siguro dagdagan ko lang, no, yung question na parang ano yung mga programa na sa tingin nyo na dapat bigyan pa ng karagdagang budget dito sa DSWD. And I think si Tanya partially answered some of these na, no? But maybe the others can chime in.
Yung cash transfer program, meron long-term vision yan na dapat napabilis no? At for me, matagal ko kung aralin mo, no, ang ilang discussion sa amin sa development sector, makakatulong ba yung non-conditional cash transfers? In other words, cash transfer lang na siya namang ginawa natin nitong panahon ng SAP. Di ba? At maraming nagsasabing, kasi tamad sila, kasi hindi ganoon kasi ang aking pananaw. Ang aking pananaw, kapag ang ating lipunan ay may responsibilidad sa bawat isa sa atin na hindi naman dapat tayo magutom. Basic yun Basic human right. So sa akin, hindi pa nga yung masustain lang na mabigyan pa ng more yung poor, but that's really important. No? So, ang first step dyan, kung itatanungin mo, nabanggit na nga ni Tanya na reflect yan dun sa mga sharings ng mga tagapagsalita para sa sektor ng elderly at saka yung mga beneficiaries ng 4Ps. Dahil sa crisis, dapat malawakan yung increase sa budget niyan kasi mas maraming mangangailangan at yung governance issues, no? Meron sanang maayos na at pwede sanang ayusin pa na sistema yung gobyerno na hindi ginamit nung unang release ng SAP kaya mas lalong nagkagulo, no? Meron tayong statistics on poverty and who are the poorest families. Nagawa na yan ng ating statistics office before the pandemic pa. Hindi natin alam kung bakit hindi na lang ginamit yan. No? So, dapat mag-increase yan. Pero sa tingin ko, sa panahon ng COVID, mas lalo na, walang masama kung i-increase natin unconditional cash transfers para dun sa talagang nangangailangan na wala na talaga. Hindi, maghanap ka man ng kasalanan. Although hindi talaga ako naghahanap ng kasalanan sa mahirap. No? Ito yung mga nawalan lang ng trabaho. Di ba? Gusto nilang magtrabaho. May trabaho sila, pero sila ay nasa restaurant industry, sila ay nasa public transportation, sila yung mga OFW na pinauwi, sila yung mga nagtatrabaho sa mall na hindi kumikita yung nilang mga tindahan, sila yung employee sa mga small industries and entrepreneurs. Ito yung mga, they are decent, honest people who want to work. So, I would really see kung ito ay COVID budget at ang pinag-uusapan lang, DSWD budget, I would really like to see tremendous increases in SAP that allows them actually to give unconditional cash transfers. Where there is literature that it still works, it still accomplishes what you want to accomplish, but also does not encourage yung mga kinatatakutan ng mga opisyal nating masyadong mapanghusga na kunwari nagme-mendicancy, walang ganong effect. No? Ngayon, yung sa PhilHealth, maawa dapat tayo sa private healthcare system. Our private healthcare system is bigger than our public healthcare system. Kung pansin niyo po, ang mga unang tinamaan na hospital at unang umiyak na mga hospital ay yung mga malalaking private hospitals dito sa Metro Manila kung saan napakatindi nung onslaught ng COVID. Sila yung tinamaan ng husto na kawawa at sinabi hindi na namin kaya. Diba? At ano ang sinabi ng gobyerno? Bawat COVID case, hindi magbabayad 700,000 lang daw ang bibigay ng PhilHealth. Alam niyo ba kung gaano kalaki umaabot ang gastos ng isang pasyente, private or public hospital niyan, way above 700,000. Kasi ito na nga, remember, ang COVID tumatama sa mga medyo may katandaan na at may comorbidities. Kaya kung babayaran mo lang yung pneumonia, yung tao ay kaya na ospital may diabetes, may kidney problem, kailangan ng dialysis, milyon-milyon na. Ang hinuhut-hut, ini-extort actually ng PhilHealth from our private sector. And I really must warn government, if the private sector fails, more than half of our healthcare sector will fail. Kasi ito na, singilin mo na yung gobyerno, di ba? Hanggang ngayon, ang majority hospital beds ay private. So may problema. The government has to save the private sector at alam natin yung lumalabas na skandalo sa PhilHealth, yung kung sinong hospital na maliit na hindi man natin alam kung anong kinontribute talaga dun sa COVID problem ay milyon-milyon ang nakukuha o bilyon, habang the big hospitals are not receiving, even before COVID, hundreds of millions of PhilHealth reimbursements. Tapos, hindi na nga nababayaran noon, hinuhut-hutan pa ngayon, kaya that's the other thing. That's why I mean by, ayan lang ang budget nyo, iiyakan natin kayo kasi we need massive increases. And if you look at what the economists are thinking, itong request namin from the health sector na lakihan, yung request ng DSWD na bigyan pa ng more SAP, hindi pa yan yung big issue kasi nga yung jobs generation na siguro sa next webinar pa, ang laki-laki rin nung pangangailangan doon. So what kind of pipitsugin budget this is, di ba? Again, yung ilang mga kaibigan sa ILEAD ang nagkwento sa akin, nasusunog na yung bahay, yung gobyerno binigyan tayo ng tabo para maampat yan sunog na yan. We need a fire hose. So we need that. Lastly lang, Aika, kasi nagtanong ka, hindi pa natin napag-uusapan yung social service na education. Napakaliit ng mga eskwela natin na internet connected. Kahit public school lang yan, And of course, itong mga walang internet connection na ito, if you want to talk about equity, ito yung mga eskwela sa malalayong lugar, sa mga liblib, yung mga eskwela kung saan pumapasok ang mahirap. At ito yung nangangailangan ng internet connection. At alam natin na internet connection, hindi ano pa lang yan, step 1/2 o step 1/4 para masagutan ang pangangailangan ng education sector ngayon na harapin yung sitwasyon, di ba? May internet connection man yan, may gadget ba yung estudyante? May gadget ba yung teacher? Kaya ba nung teacher na gumawa ng mga kurso at saka syllabus at saka mga lesson plan na naaayon sa remote learning? Kung wala mang remote learning, paano matututo yung mga estudyante sa bahay? Paano yan pina-follow up? Hindi ba kailangan rin natin ng parang barangay health teachers katulad ng barangay health workers para umikot-ikot sa mga bahay? Kasi hindi mo rin na naman pwedeng iasa yan yung sa kamamang nanay na nagti-triple overtime na sa bahay ngayon dahil sa COVID. At sabi pa nga nung ilang mga nanay sa amin, kaya nga namin pinapapasok yan sa eskwela dahil mangmang kami. Alam naman kami magtuturo. Kaya nga gusto namin ng a better future for our children. Kaya namin pinapapasok. Ba't nyo aasa sa amin ngayon na kami ang tumulong dyan na matapos yung lessons? So, even the education system is crying out for massive increases in funds. So if we're talking about social protection or social services, the big three, DSWD, Department of Health, and Department of Education, setting aside na governance is really a problem in all these three, di ba? Setting that aside, we need to look at budgets, big budgets that that and my the stimulus budget is data rich, yung presentation ng Arise Bill. Kasi kinausap nung mga authors yung mga sectors na yan. Tinausap nila ang education sectors, kinausap nila yung mga sectors, anong kailangan nyo, magkano ang kailangan nyo. At ang laki nung hinihingi. Eh sabi nga ng ating hindi ko naintindihan na sagot, wala ayaw namin magka-budget deficit. Anong gagawin natin? Ang sagot ko dyan, magka-budget deficit kayo. And I would argue that this is not me just being matigas ang ulo. I'll pass that on to the economists. But the economists are saying, that is not an unreasonable position to take now. Let's have a budget deficit in order for us to save the economy and keep us productive.
Thank you, Dr.
Yeah.
Claudio. I think si Ora merong gustong idagdag.
Yes, thank you, Dean. Maganda yung nabanggit talaga ni Dean. Pero gusto ko lang ito liwanagan yung sa question mo rin na ano yung dapat idagdag. We have a group, there are a group of civil society are pushing for a universal social protection. Kasi we saw na from the pandemic, nakita natin kung gaano ka-problematic yung targeted na nabanggit din bakit yung middle class wala, bakit tapos yung mga ganun, no, na sila yung nagpipay na nakita natin everyone could be at their point of their life could be vulnerable, and alam naman natin na very high risk din ang Pilipinas in terms of the calamity, no, but there are key social protection program na gusto namin mabuo, yung sa universal, magkaroon tayo ng universal social protection floor. So ano-ano ito? So yung disability allowance for persons with disability. This is on top of what they are receiving sa Pantawid Pamilya program. This is also universal child allowance, meaning so hindi na siya katulad, ang ganda nung sinabi, no, hindi siya conditional. So non-conditional, these are so many studies na nagpo-prove na effective pa rin at namimit yung goal even without the conditionality, and given also that we cannot do the supply side, this might be a good consideration for the government kasi nagiging additional administrative burden lang siya and hindi siya rights-based. Kasi ang pagtingin is you need to be a deserving, you need to do something for you to deserve this one. And then third is yung support for the informal workers. So this could be, one is paying the premium payments of the workers in the informal economy so that makasama sila sa SSS and they can be included in the unemployment insurance. Kasi walang unemployment insurance, yun yung hindi pa natin natatakal, those who are working in the streets, the drivers, yung mga ganyan, no? So nakita natin ngayon kung gaano siya kawala. And then fourth is syempre yung pinupush namin, we did a study on this, the feasibility of a universal social pension. So we see that in some countries, they started per layer. Halimbawa, in-start sa social pension kasi most household has an elderly at their home. So pwedeng a pension could be an economic stabilizer, at the same time an economic stimulus kasi yung family, the whole family could benefit kung may isang senior citizen sa household. Tapos, gusto kong emphasize yung nakalagay sa may NED sa ating Philippine framework na operational framework ng social protection. Sabi doon ay inclusive, rights-based, and transformative. So, sana talagang ganito rin yung budget natin kasi nakikita natin hindi siya inclusive ngayon, hindi rin siya rights-based, at higit sa lahat hindi rin siya transformative. Tapos, I'd like to point out then na sa region, sa Asia Pacific, we only have 3.7% the average of spending of social protection. Pero ang Philippines only spend less than 1%. Only 0.8% of our GDP is spent on social protection. So the United Nations, SCAP, is suggesting that the Philippines should increase the budget by 10%. 10%. So ibig sabihin, by 10 times. So meaning even prior the pandemic, ini-emphasize na kailangan natin mag-level up ng spending. So this might be the opportunity for that. So given that, I'd like to emphasize two things. Financing social protection or putting budget to social protection is both political and technical question. So magandang in-emphasize ni Dean Guy whether saan natin kukunin yung pera. Technically, uutangin ba, magtataas ba ng taxes? Or kami, ang pinupush namin is progressive taxation, meaning we tax the rich. We tax the billionaires. So meron din siyang distributive capacity kasi madidistribute yung wealth. No? So, and then second is political. So, ganda yung in-emphasize ni Robert kanina na marami dun sa decisions sa budget ngayon are mainly political. So, saan nga ba nagpupunta yung mga politicians natin para makita nila at maramdaman kung saan ba dapat naaayon mapunta yung budget. Sa naaanod ba na buhangin o sa pagkain na kumakalam na senior citizen, o sa bawat nawalan ng trabaho, yun nasa kalsada. Ano. So, yun. And last point lang, financing social protection is not a cost. This is an investment. So this might be a perfect time. This is a good perfect time for the Philippines to realize whether mag-i-invest ba ako sa magandang social protection system or papatsi-patsi lang, including na rin dito yung pag-invest sa magandang database system and also yung administrative and including na rin yung delivery system, but also yung cash transfer itself. Magle-level up ba tayo ng expenses? At least dun sa may marireach yung poverty, at least yung poverty line, o gusto lang natin yung tulad nito, 500 pesos, ano na lang mabibili na to para sa senior citizen sa panahon ngayon. So, maybe this is about time. At ito yung lagi namin emphasize, this should be an opportunity for us to level up our social protection system. So, with that said, so thank you dun sa opportunity for this. And sana, given the remaining days na meron pa, mahabol pa sana natin na maitaas pa talaga yung budget for social protection.
Pasingit
Thank
lang, Aika. One sentence na baka segue kay Tanya. Ang maganda rin dun sa unconditional cash transfer, yung sinasabi rin ni Aura na gusto ko lang i-pick up ng gusto. Simple lang ang administrasyon niyan. Walang mga, are you deserving? Will you fill up this form? Ano ba ang income level mo? Diba? Basta na-decide. Tapos yun, ibigay mo. Wala na yung mga dinadala mo ba yung anak mo sa ganito? So, it is also a double benefit if we are talking about both increasing the budget and simplifying the governance part of social protection.
Okay. Thank you po. Siguro bago ko lang tama po si Dr. Claudio, no? Sa segue ako kay Tanya. Kasi maganda tong mga nabanggit ni Ora, no? Lalo na yung universal social pension, disability allowance, child allowance, premium, yung pag-shoulder ng premium payments. Siguro, ang tanong ko lang, given na may experience ka nga sa DSWD, no? At nakikita natin na nagbabalon yung administrative costs, lalo na kapag merong mga ganitong programa. Siguro, paano mas magiging efficient yung ganitong pagbibigay ng ayuda or tulong sa ating mga vulnerable sectors?
Siguro dun sa mga nabanggit na kanina, siguro yung approach yan, no, pagiging mas universal at stringent doon sa mga requirements. Kasi narinig nga namin from the ground and siguro si Ate Ana mako-confirm din ito na minsan yung mga requirement para sa mga social services at access kung magkailangan ng ID o di kaya birth certificate na napakahirap din talagang makuha for some of the vulnerable sectors to get. And then pangalawa siguro para maging efficient din, kailangan din talagang, yun nga, sabi rin nga ni Aura na hindi nga siya cost, investment siya. So ngayon, investment talaga to invest in our systems on how we can invest in technologies and also to find out ano ba yung protocol para mas mapabilis itong pagbibigay ng ayuda. So simple, ATM pa lang eh. Parang yung Pantawid halos, I think halos 3.6 na po yata million yung merong ATM, majority of them, or 1.6 million. Ano ba Ate Ana? Ilan po ang may ATM? Yun, so parang meron po sa kanila may ATM na, pero meron pa rin talagang wala. I also found out in the news na social pension, magsisimula na pong mag-ATM na rin. So itong mga hindi naman siya rin rocket science. So, bigyan mo sila ng ATM, mas mapapabilis yun at to make the requirements less stringent. I think that would be, and also that universal and rights-based perspective in social protection and also looking at it as an investment, yung mga nabanggit na kanina. Talagang importante ito to make things efficient. Siguro additional na rin, hindi ko rin kasi alam kung nagkaroon na nito, pero kailangan din talaga natin tingnan, no, kung ano ba tong sa lahat at dinami-daming mga interventions na meron tayo for poverty reduction o kaya for health, ano ba talaga dito yung pinaka cost effective din para sa ating gobyerno? Dahil nga although we have space really to borrow money and to spend as much because that will stimulate the economy, parang we need to be very intentional and really to assess kung ano ba yung mga paraan na hindi talaga masasayang bawat peso na nakukuha natin.
Okay. Sige. Thank you, Tanya. We will transition na to take some questions, no? Kasi meron din tayong questions from the viewers. I-recognize ko lang ulit. Hello, Robert. Hi.
Hi.
Yan. Okay. So siguro dun sa mga late dumating, ulitin ko lang, this is the first budget webinar hosted by Rappler and iLead. So si Robert is from iLead. He was able to give us a very insightful presentation on the DSWD budget. So siguro for the first question, no, maybe si Robert or anyone can answer. There is this question, anonymous attendee. Do you think po ba na i-consider pa ng mga lawmakers and even ng Malacanang ang series of Bayanihan Acts next year for COVID response and social protection in addition and exception pa sa proposed 2021 budget? So additional daw.
I think it would be best if ngayon pa lang i-consider na yan. Unang-una kasi I don't think we're under the assumption na matatapos ang COVID by December 2020, diba? January 1, pagpatak ng January 1, wala nang COVID. Hindi ganoon. Pakikita kahit sa recent declaration ni Presidente na until September next year, nasa state of calamity tayo. So I think that is recognition enough na hindi matatapos agad. With that in view, I think it would be more prudent if ngayon pa lang plantsahin na natin yung mga programa para hindi na kailangang ma-realign, hindi na kailangang magdagdag, etc. etc. Usually kasi kapag nailaan na yung GAA, may iba nang umaasa dyan eh. So pag naglaan ka ng ganito karaming bilyon sa isang programa, may mga aasa ng beneficiary doon. If magbabayanihan 3, 4, 5 pa tayo, hindi naman huhugutin out of nowhere yung pera. So kung kukuha ka ng pera to fund, for example, additional SAP or other programs, may mawawalan. In case of, I think this year, kumuha ng 142 billion from DPWH. So instead of building roads, bridges, etc., kinuha from there para nilaan dito. And then also, meron din mga funds na nakuha from other social services. So I think it would be better, it would be prudent. Ngayon palang planuhin na natin, alam naman, hindi na tayo gulat by the time na ipapasa natin itong 2021. Alam na natin ng COVID, we've been dealing with it for months already. So, better if wag na nating iasa pa sa Bayanihan 3, 4, 5. I don't think anything will substantially change by then. So, yeah.
May gusto po bang magdagdag? Pero before lang, no, I agree dapat nasa 2021 proposed budget na siya. So, kung titignan, syempre, we don't want another law to be passed, tas magugulo lang ulit yung budget natin. Tingnan natin sa nangyari ngayon. Kanda gulo-gulo yung 2020 budget natin because there wasn't any, additional, or there was lack of foresight when the 2020 budget was crafted last year and passed last year. Yun. Si Ora,
sorry, go ahead.
I see Dr.
Sige lang, Ora na muna.
Okay.
Sige, Ora.
Quick respond lang. So, I understand minsan mas madali kasing ipass yung mga piecemeal. Pero this tends to fragment further yung social protection system natin na sobrang fragmented na. So we need to have really a really comprehensive, tapos yun talaga yung budgetan talaga ng bongga. Pero ngayon kasi piecemeal siya eh. So yun lang.
Ay ka dun sa ako kasi yung tanong na what about next year? Pwede yun, pero dun sa analogy na nasusunog yung bahay mo, Kung bigyan niya ako ng ng isang buong fire truck next year, pero na lang, ashes na lang yung bahay ko, what's the point? It's very clear. The economic urgency is now. The need for proper stimulus packages, not just for the economy, but for social protection is now. Ang tao hindi magugutom next year. This year sila nagugutom. Ang mga bata, hindi nahihirapan na internet access para makapag-aral next year. Nahihirapan silang magka-internet access this year. At yung mga tao, nagkakasakit at namamatay from COVID. Sige. I'm beginning to sound like a politician with great rhetorical points. No? Pero that's really it. Now, we need to do it now.
Thank you, Dr. Claudio. Meron pong isang question dito. Ang sabi niya, ano raw pong opinion ninyo dun sa 10 billion SAP surplus na banggit to kanina ng DSWD niya allocate for livelihood? Do you agree with this decision, or do you think that the 10 billion should still be disbursed as SAP to those who have not received any benefit like GP drivers and farmers?
Sige.
Go ahead, Robert, you.
Very quickly. Kasi we did a recent press release on this. And we believe na this is not the time to generate savings, especially kung sa SAP. This was specially released to help. 10 billion din yan. Ilang pamilya din yung matutulungan dyan, matatawid, especially kung di pa nila nakuha yung trabaho. So I think kung livelihood program kasi may proseso pa yan, may validation as pointed out earlier. Kung sa transfer, ibigay nyo na, total para naman sa kanila yan. So bakit pa natin i-withhold? So, no.
Just also a quick response to rejoiner to Robert. Yes, there's so many countries now. There are in fact 195 countries who initiated an improvement in their social protection, no? So, and one of the reasons is they use this as economic stimulus or economic stabilizers. Kasi you need actual kagad na cash. So, kailangan na yung cash ngayon para umikot. Isang factor din yun. So, hindi rin ako economist, pero as I understand with the literature and also the experiences of the countries I'm working with, so they're using this para umikot yung pera agad at magamit. So, there's, another factor why some countries also expanding pension is sa pension kasi older persons don't tend to save. So, they would spend it. So, iikot yung pera and magkakaroon ng additional capital. So unlike with livelihood, and to be honest, titingnan mo pa yung marketability niyan or magsasend pa sila ng proposal diyan sa livelihood proposal, marami pang mga studies na gagawin yung applicant, no? So I think talaga I would agree with the rest na direct na cash, inject talaga ng cash sa or either cash or voucher. Voucher also has in other countries voucher kasi they know that it will be spent, hindi itatago. So that might be considered as well.
At tweak
Si
ko
Ate
lang,
Annabel, ay
Go
sorry
ahead.
po Dr. Claudio, si Ate
Sige
Annabel
lang,
gusto
Ate
daw
Annabel.
pong
Go ahead, Ate Annabel.
Unmute ka, ate.
Nakamute po kayo.
Unmute ka, ate. Unmute.
Okay.
Ayan.
Thank you po, lalo na kay Doktora. Talagang napakaganda po yung inyong na ibahagi at yung inyong opinion. Yung tungkol po dun sa 10 billion na sinasabi, mas maganda po talaga na na lang po ng SAP para pa doon tingnan natin tingnan din po natin yung mga middle class kasi parte pa rin natin sila di ba? Pilipino rin yun, kapwa Pilipino namin. Although mahirap din kalagayan namin, pero bigyan din natin ng bigyan din sila ng pagtingin. Aside sa aming mga purpose, na sana pa, ang hiling lang naman ng mga purpose ay maging update and maging on time yung aming payout. Katulad niyan, may UCT din, kasama rin kasi sa 10 million ng beneficiary ng UCT, yung unconditional natin, purpose po, yung 4.4 million. Pero sa itong 2020 natin, wala pa po kami nare-receive na UCT. Kasi kailangan din po namin yan kasi nilalaan din, lalo na papansin nyo, magpapasukan po, problema rin po, lalo na maraming tinamaan talaga, mahirap, di ba, sa sitwasyon ngayon. Bakit pa kailangan i-ASLP yan? Maraming talagang proseso, meron hindi kaya, meron ayaw, natatakot kasi hindi naman nila kayang maging successful dun sa papasukin nila. Pero yun nga sabi, di ba, aanhin mo yung damo, papatay na yung kabayo. Dapat talaga, kung ano yung problema ngayon, yun ang pagtuunan natin, doon tayo mag-concentrate, bigyan siya ng solusyon. Hindi yung plano ka ng plano, puro plano pala yun. Di ba? Katulad yan, parang natuwa ako, ako doon, naalala ko yung meeting, yung nabanggit ko kay Ma'am Tanya, may budget. Sinasabi, allocated ng budget, pero wala naman palang physical money. Kaya pala ang Lucity hindi pa nare-release kasi wala talagang yung pera, hahanapin pa. Kasi dapat doon, nagkakaroon din po ng transparency, na kung saan napunta yung mga allocation ng budget. Tapos ngayon pinag-uusapan na yung para sa next year. Tapos hindi mo maramdaman yung mga pinaglalaanan nilang mga budget na pagkalaki-laki na hindi naman nararapat. Dapat talaga nasa social protection, nasa DSWD, na nandito naman po tayo, na tayong bawat Pilipino, na maliit man o malaki yung aking tinatax, may karapatan po tayo na punahin, tignan po, bantayan yung ating budget kung ano nangyayari sa ating sa ating estado, para naman po to improve, hindi naman po para magkawatak-watak tayo. Pero sa nangyayari ngayon, dahil nga ang sistema natin ngayon, napakasakit po na nangyayari, na talaga dahil sa SAP, nagkawatak-watak kapwa Pilipino at inaaapakan ang purpose po. Kasi nga, dahil sa mga dahilan na lang, dahil nga hindi sila nagkaroon, hindi sila nagtulungan ng ayuda, nasamantalang pandemic po ito, lahat po apektado, mayaman, mahirap po. Kami pong mahihirap, nakakaunawa rin po kami, na may damdamin din yung mga kapwa natin na nagtatrabaho ng higit na mas malaki ang tax, pero lahat po dapat pinantay-pantay. Kahit maliit na amount, basta lahat po nabigyan, wala hong mag-aaway, di ba? Kaya ito sa panahon ngayon, mas maganda na yung pandemic kasi, hindi yan masasabi nga, sabi nga, hindi yan hanggang September 2021 lang, di ba? Kailangan natin talaga tignan mas malawak, mas malalim yung problema, na i-focus natin yung mga magiging pagtugon. Hindi yung na tinatabunan kung ano-anong issue eh. Tapos yung PhilHealth po, totoo yan, doktora. In 2 days lang po, yung isang mahirap na senior citizen, tinakbo sa isang private hospital, pero mo nakapag-bill siya ng 166,000, pero hindi po yan kinover ng PhilHealth. Kasi hindi daw po admitted dahil doon na siya tinreat sa emergency. Diba? Ang sakit po sa pagiging mahirap, pero doon sa certification na hiningi, nakalagay admitted. Ano po bang pagkakaiba? Pag mahirap ka, kulang ka sa kaalaman, kawawang-kawawa ka sa gobyernong ito. Diba? Hindi mo alam kung sino yung kakalingas sa'yo, tutulong sa'yo. Pero ang kagandahan lang po sa 4Ps, may mga FDS na binibigay para kami ay ma-empower. Kaya ayun po ang kailangan din natin. Ngayon, kung sa panahon ngayon, makakatulong din po yung sinasabing mga unconditional. Kasi depende po yun sa sitwasyon na kinakaharap natin para pagtulong dito sa pandemic. Kasi kung magpupunta pa tayo sa maraming conditional, baka nga po kahit next year tayo mag-ayos kung wala pong mga pang-documentation yung at kapwa namin mahihirap. Ang hirap po, 195 ang birth certificate pagkuha, ay sus, wala pong mangyayari. Talagang yung yung pakikikapwa-tao ng gobyernong ito, parang talagang negatibo para sa kapwa talaga namin, lalo nang mahirap na nadadaanan ng ganitong crisis. Kaya yun na masasabi ko po, na sana yung budget madagdagan din, at saka talagang ataduhin sa tamang mga programa. At wag naman po sana puro press release na ito nabigay na pero wala po. Ang daming kumakalam at nagugutom po kahit mga driver po sa kung saan tayo titingin. Sana magkaroon po talaga ng pantay na pagtingin para sa manhihirap po, dahil marami tayong mga driver na namamalimos na biro mo kahit bilang isang leader, mahirap po na makaka-receive ka ng mga text or makakausap mo sila na kahit isang butil na bigas wala po. Pero itong gobyerno natin, makikita mo, napupunta sa ibang mga issue at saka mga pera po, napupunta sa wala lang. Sana po ganun ang mangyayari ang pagtingin ng paggawa itong sa pag-aano ng ating budget na sa ngayon at saka hindi na para sa next year na budget. Sana yung ngayon po pagtuunan talaga ng magandang tugon para sa kinakaharap po ng nating lahat.
Thank you, Ate Ana. Actually, sobrang ganda ng discussion natin today, no? Kaya lang, kulang na tayo ng time. Maybe we can also bring this offline, lalo na dun sa mga viewers natin na baka meron din silang mga gustong pag-usapan tungkol pa dito sa DSWD budget at sa malaking issue nga ng social pension. So, siguro nahingi lang ako ng a few words sa ating mga panelists bago po tayo mag-end. Unahin na po natin si Aura.
Yes, thank you again. So, let's sana mas makitaan natin, tutukan natin to for the next coming months. So, hanggat hindi pa tapos yung budget, and let's look at social protection as an investment. Tapos, we know for some countries who have universal social protection has able to deal with this pandemic. And if we have this, we will able to also to withstand future crisis, not only this one. So we should really look at this as investment. Tapos second point lang, maraming discussion dun sa chat that were raised by Alce from Social Watch, because Social Watch has been working on this budget engagement at the same time. So sana we work together para ma-push and mas stronger yung bosses natin sa pagbabudget at talaga mapakita natin na yung purse ng budget, the power of the purse ay nasa tao. Yun. Thank you.
Tanya?
Ayan. So, yun din po. Salamat po sa opportunity na to para mapag-usapan yung budget. Bantayan po natin ito, no? Siguro nung COVID na-highlight din, if you've heard of the Citizen Budget Tracker, and of course you have Social Watch who's been doing this for years. Meron talagang interes dapat ang bawat isa sa prosesong ito dahil this will affect us one way or another. At social protection nga ang isa sa mga importante na ating kailangan tuunan ng pansin. Hindi lang sa national budget, pati yung local budget nyo, kailangan nyo rin kilatisin yan dahil nabibigyan din naman ng mga pondo ang ating mga local government units at sila rin ay parang frontliners natin dito sa COVID. So yung pagbabantay din sana natin ay mas malawak pa. And then, abdi din ako, talagang tulong-tulong tayo. Salamat dun sa mga storya din ni Ate Ana na nagbigay talaga ng konteksto sa mga kinakaharap natin ngayon. Yan.
Okay. Thank you, Tanya. Dr. Claudio? Ay, nakamute pa po kayo.
Yeah. Unang-una, nagpapasalamat ako sa Rappler, siyempre. Medyo bahay ko din to kasi matagal din ako nagsulat para sa Rappler at medyo under threat din yung bahay. Kaya gusto ko sanang ibigay ang aking suporta sa Rappler. Nagpapasalamat ako dito. At sorry, last words kasi taga every woman ako. Medyo baka barilin ako ng mga kasisteran ko sa every woman. Hindi kami violent, feminista kami. Pagagalitan lang ako kung hindi ko ma-mention na yun din yung isang hat. So as one of the co-sponsors, pinapasalamatan ko rin yung aking other co-sponsors, ang Rappler at ang iLead. Pero punta tayo dun sa substance. Sa tingin ko, ang central kong message ay kailangang mas malaki ang budget natin than the one that's being proposed. And the increase has to be in areas of social protection and economic stimulus that I think will be tackled later. No? At ang final ko dyan, huwag alalahanin kung saan kukunin yung pera. Ito yung panahon na kahit mag-budget deficit tayo, let's bite the bullet. Kaya nga tayo nag-work so hard to have that good rating internationally para magtiwala yung mga tao na pwede tayong pahiramin ng pera. Pero dun sa discussion nga, ang daming napakagandang mga iba pang suggestion kung paano natin ma-raise yung necessary finances para ma-fund ang COVID budget. So let's really appeal to both executive and legislative. Bantayan natin yung budget hearings ngayon so that we can have more of a really much bigger budget para makaahon na tayo at makalabas sa COVID. At okay lang naman sa akin kung ang mga politiko ay isipin kung paano sila ma-re-elect. Hindi naman masama yun eh. Pero sa tingin ko, kung gusto nyo ma-re-elect na sure na makakatulong kayo, na hindi kayo gagawa ng mali, di siguraduhin na tama ang response natin to COVID. No, local politicians, national politicians, they will be judged by how they have responded and will respond to this crisis. This is the one na front and center kaharap ng Filipino people. Hindi pwedeng hindi kayo husgahan pagdating ng eleksyon kung paano nyo hinarap itong krisis na ito.
Thank you po, Ate Annabel. Ate Ana.
Okay. First po, thank you po dito sa opportunity. Napakaganda po nung ating talakayan, itong mga ganito na na-share namin kung ano po yung nangyayaring katotohanan at dinadanas ng ating mga kapwa maralita. Maraming salamat sa Rappler at sa ID po at sa lahat po ng nasa panel and then yung mga nag-register. Talaga pong inaasahan po namin at na ang bawat isa talaga ay magkaroon ng puso o atensyon, panahon para pagtuunan natin kung ano po yung solusyon para sa lahat. Na para hindi na lang po para puro hindi naman po kami puro daing lang, pero maasa pa rin kami na isa kami sa makakaambag kung ano yung makakatulong para sa ating kinakaharap na pandemic. At bilang sa SNPP po, nagpapasalamat po kami kasi po patuloy naman po kaming nagmamalasakit sa kapwa namin mahirap, ganun din sa kapwa namin na talagang maging instrumento para ipahayag po na kaya rin namin na tumulong, basta po alam din po namin na andyan po ang lahat na may puso naman din po sa aming mahihirap. Alam naman po natin yon na mahirap yung pinagdadaanan. Pero sabi nga, kapit lang, maging positibo lang. Pero kailangan pa rin pong kumilos, kasama ninyo, nandito lang po kami para rin po, tumulong sa ating, para mag-improve pa po yung ating gobyerno.
Thank you po, Ate Ana. Robert?
And I think just to round off the discussion, it's very clear na social protection should be prioritized, especially now na it's the time of the pandemic. Kasi spending on social protection and human capital is not sunk cost. Hindi naman yan gastos na patay. Malaki yung balik niyan, especially on human development. Sabi nga ni Ate Ana kanina, kailangan lang naman panimula. Di ba? Parang makaumpisa sila ulit. Hindi dapat pinagtutunggali yung mga nangangailangan. Yung beneficiary, yung seniors, yung PWDs, hindi dapat siya naglalaban-laban sa resources. Kung kaya namang maglaan ng pondo para dun sa ibang aspeto ng gobyerno, bakit hindi na lang dito? Lalo na't ngayon nangangailangan. So kung saan kukunin yung pera kung kailangan umutang, sige, utang tayo. Basta yung gamit sa utang, productive. Hindi yung perwisyo lang na babayaran in the future. Diba? So kung utang tayo, sige, basta mapupunta dun sa mga nangangailangan. And of course, we appreciate that in the NEP, tumaas yung budget ng DSWD, kahit 7 billion lang, tumaas pa rin siya. And we appreciate that from the government. But again, we can do better. We're asking for higher budget, higher allocation, and innovations in social protection. If para sa kanila, ayaw nila yung cash transfer, maybe we can try cash for work programs. We can try paycheck insurance programs. Basta wag lang bibitawan yung tenor ng social protection. So yun, pointed out kanina, ang social protection, hindi lang yan tungkol sa DSWD. Marami pang tumatalon-talon na department dyan. And we hope to tackle that in the succeeding webinars that we'll be having. So, maraming salamat.
Okay. Thank you, Robert. So, napakaganda ulit nga ng discussion natin ngayong araw, no? We saw the need to increase the budget dahil nakita nga natin na hindi siya parang COVID budget. para lang siyang bago mag-COVID or may assumption na tapos na yung COVID at parang walang nangyari. Nabanggit to kanina ni Dr. Claudio. So, dun sa tanong na ano ba dapat yung mga pagtuunan ng pansin o mga programang dapat laanan ng mas mataas na pondo. Narinig natin kay Ate Annabel na dapat trabaho, social capital, livelihood capital ang isa sa mga kailangan tignan. Nabanggit din ni Ora yung mga iba't ibang universal social protection gaya ng disability allowance, child allowance, ang pagbayad ng mga premium para magkaroon ng insurance itong ating mga nasa informal economy, social pension. At syempre, dapat itong pagbibigay na ito ng ayuda, ng tulong sa ating mga vulnerable at marginalized sectors at even sa middle class sector na nabanggit kanina ni Robert dun sa ating Q&A na dapat inclusive, rights-based at transformative siya. So siguro isang malaking question din para sa mga tao na paano ba natin popondohan to? Nabanggit kanina ni Dr. Claudio na kung kailangan ng umutang, bakit hindi umutang? As long as alam mo kung saan mapupunta at paano mo siya ipamimigay. At sinabi rin nga kanina, no, na kung nasusunog na, bakit mo bibigyan ng tabo? So, yun lang. Thank you so much for tuning in. This is the first episode of the Budget Webinar series. This is hosted by Rappler and I lead. I am Ikare. Thank you for watching.